What a catastrophe. India has just posted yet another record daily high of coronavirus infections and deaths. In the last 24 hours alone, India has seen a record 412,000 new coronavirus cases and close to 4,000 deaths. And COVID-19 infections have now surged past 21 million across the country. Joining us now is Ishan Garg, all the way from New Delhi. So give us a sense of what's happening on the ground in India right now.
Well, on the ground, there is a severe shortage of medical equipment and oxygen in several parts of the country. The capital city of New Delhi itself has sounded the alarms many times in the past few weeks, asking the federal government to increase its quota of oxygen. There are several dozens of patients who have died in hospitals because of lack of this critical gas here. At the same time, there is also a shortage of potentially life-saving drugs such as remdesivir. But at the same time, there is also an outpouring of help and support from different sections of the Indian society. People are helping each other online by providing references and links to hospitals where people can find beds, or to even plasma donors and blood donors. So we are seeing a massive sense of responsibility among the community as well, which is of course a direct response to the pandemic.
Now, who is at most risk? Which parts of the country have been most badly hit?
Well, the state of Maharashtra and the capital city of New Delhi have been the worst hit places in the entire country. The Maharashtra is the richest state here, but it's also worth noting that these two states, which have reported one of the highest cases for the size of population that they have, are also the states which are carrying a massive number of testing among their population. In terms of the people who are the most vulnerable, it's really going to be the people who are in the lower income group, because while people who work desk jobs or people who are rather well off have the luxury of staying indoors, but in a country of 1.3 billion people, social distancing is often not possible, especially in smaller towns and villages where people are living in close quarters. And of course, the healthcare infrastructure in those small cities is also not the best, making things worse for people who are living there.
So, how did it get so bad? What can this be attributed to?
Well, the government is attributing this spike in infections at least partially to the doubly mutated B.1.617 variant of the coronavirus. It's saying that this is responsible directly for the spike in infection in at least some states. Experts are concerned that this is a super spreader variant, but at the same time, they're also pointing out that many public gatherings that took place in the past few months, be it of the religious kind or of the political kind, tens of thousands of people attended those, and the spike in infection is a direct result of that, and the government should have never allowed such massive gatherings to take place. But of course, when the first wave subsided, the government declared victory over COVID, and experts say that it shouldn't do that when the second wave comes down, which it will eventually.
So how is the government now assisting hospitals?
Well, the first thing for the government to do while assisting hospitals has been to increase the supply of oxygen, because that's something which is absolutely crucial and has been in acute short supply. So the government is working on creating more and more oxygen plants. It's also working to divert some oxygen for commercial use towards medicinal use. But at the same time, there is also a shortage of pharmaceutical drugs. So Prime Minister Modi has been meeting with industry leaders and also with his cabinet ministers to try and boost that manufacturing. And then there is the vaccine. The government has provided some financial assistance to vaccine makers, hoping that they will be able to increase their production and thereby helping India's vaccination drive in the future.
Now, has international aid helped? Has it assisted in any way?
Well, aid has arrived from more than 40 countries so far. There have been hundreds of medical equipments and thousands of metric tons of oxygen that have come in, and all of this is extremely well appreciated. But there is a problem with the division of it. Critics are saying that the government is sitting on a lot of aid and not being able to divert it to the states who need it the most. The government, of course, says that these are only teething issues, and it has got a framework in place to divert all that supplies to the states that need it. Health experts are also saying that given India's demands, all this aid is only a drop in the ocean, but at the same time, whatever and howsoever many lives it can save, it's all appreciated.
Why is it so important that the world fights together to address this outbreak in India? Why does this just go beyond the country itself?
Well, several health experts around the globe have said that if there is COVID-19 in one country, is the problem for the rest of the world as well, because the virus can travel once the travel opens up internationally. But apart from that, a high caseload of COVID-19 in India also means that India's massive pharmaceutical industry is diverted towards serving the domestic population. India is seen as the pharmacy of the world. It's the country that produces 2 billion shots of vaccine. So if India does not have a massive caseload of COVID-19, which hopefully it might not in the near future, these companies will be able to expand shots to the rest of the world, which will be incredibly beneficial. But while India battles the pandemic, all the pharmaceutical, well, at least most of the pharmaceutical capacity in the country is going to be diverted towards India, and this is all the help that the world could also use in this moment.